So grief is an experience that we have a reaction, whether it is emotional or the way that we think, to a loss. And that could be, the way that most people understand grief is when we lose a loved one or lose something that is very close to us. But what we often forget is that people who have chronic pain also go through grief, right? And so they not only may have loss of their abilities or loss of their connections with people or their job, that's the things that we acknowledge, but they may lose themselves. They may lose who they are, they may lose hope, they may lose the identity that they had before the injury. And so grief is not, there's not a definition for normal grief. It is, a reaction that you have as an individual. Where it becomes complicated or where it becomes diagnosable is when it continues to occur over an extended period of time, and there's a maladaptive way of dealing with the grief. That's when it becomes more defined. So the model initially, the way people understood it was that there were 5 stages. You started off with denial, and then you go into anger, right? And then bargaining, depression, and acceptance. The thing is that there's been a lot of criticism with the model, and so there's been updates to it. Dr. Kessler also has worked on this model and has clarified some of the things. One of the things is this fact of it's not a linear model. It's not that you have to go through one stage to go to the next. You can actually go through one stage, then go to the next stage and go right back to the stage that you were before and then jump 2 stages ahead. So it's not a linear kind of model. It's kind of a living, breathing thing, almost like the example I use in my presentation is a roller coaster. I think that's the best way to kind of describe what it feels like to have grief. And I think that everybody may go through all 5 stages, but maybe experience some stages at more length or for more time than others, right? So denial may be an immediate reaction, but then you go straight to anger and you stick at anger for a long time, and then that boils up and then you start bargaining, and then maybe you start getting angry again. For another person, it may be a longer term in the denial and then a shorter term in the anger. We're all different, but I believe that we all at some point go through some of the stages. So the goal is to reach acceptance of the situation, right? No matter how painful it might be, is to be able to continue moving forward and live the best life that you can live. But that's our goal for everyone. It's not only for people who are grieving. I think the reason why I wanted to talk about grief and pain is because we oftentimes overlook the fact that they're both occurring at the same time because they look so similar. And so if we recognize it, then we can start kind of addressing it and just talking about it versus ignoring it and not being a topic that we don't discuss. If you have a patient who you identify as having a loss, the first thing is to acknowledge that loss. Acknowledge that there's been a loss. But in order to do that, we have to be comfortable with our own feelings. And a lot of us may not be, right? And so you have to be comfortable with your own feelings. You have to be comfortable in discussing it. Once you're comfortable, that will give the other person some strength, because then you'll be able to kind of sit with them and listen to them. Because most of the time, people who are grieving are in isolation. We don't want to hurt them anymore, so we don't remind them of the grief or we don't remind them of the loss. But in fact, it's by not bringing up the loss or the grief where we're causing them maybe more harm because we're isolating them further. And so just by simply just being there, even if you don't know what you're going to say or what to say, it's about just being present with that person and just kind of acknowledging the loss that they're going through.